Good afternoon, everybody. Thanks for joining us this afternoon. I'll just wait a couple of minutes while people join on, let everyone get set up and ready and comfortable. Welcome, everyone. Fantastic to see everyone joining us this afternoon. Looks like I got good attendance so far. Don't know about where you're all from, but the weather in Yorkshire is rather wet today, so we're glad to be occupied on an indoor webinar this afternoon. Very glad that everyone could join us. Good, right, well, we will continue to let people join. Might take a few minutes for people to come on and log in, but I don't want to waste anyone's time, so we will just get going if that's okay. So again, good afternoon to everyone. It's brilliant to see you. So today we are going to be talking about managing and preventing falls to reduce winter pressures during the 2023 and 2024 winter season. So falls have always been and always will be something within healthcare organizations that need to be addressed, as they have such far-reaching effects both on patients and their families and also the organizations themselves. And I'm sure most on this call have dealt with many falls or do respond to a lot of fall situations on a regular basis. And so this webinar is really designed to bring further awareness as to the impact falls can actually have on individual patients, as well as the organizations that you work for. And then we want to give a little bit of information about how you can implement strategies to minimize these impacts and improve patient outcomes. So we have made sure that no matter which type of healthcare organization you're a part of, whether you are an emergency responder based in a hospital or indeed a nursing home, you'll be able to get value out of today's session because we recognize the fact that falls can happen and do happen in all areas. So before we move on to more about falls, I just want to introduce everyone to Vivid Care. So we have been supporting the healthcare sector for 50 years now. We are a company who specialize in specialist seating and bed solutions, moving and handling equipment such as falls prevention and patient lifting devices, which we'll talk more about, and then also mobility equipment. So we really strive to equip the most complex of cases and individuals facing challenging health conditions with optimal resources and equipment to give them the best quality of life that is available to them. And our mission there again is to enhance lives by advancing care. So we're a part of Core Care Group, which some may not be aware of. So our sister companies are Innova Care Concepts, who specialize in hoisting and installed healthcare projects. Then there's Dependall, who are third-party specialist healthcare logistics providers. And then finally, Aquadapt, to help with home adaptation. So just to give you an idea of the group that Vivid Care belong to. So that's a bit about Vivid. And then, as mentioned, stick around to the end of the session today to find out more about the Raizer Patient Lifting Chairs, which are revolutionary pieces of kit for responding faster to fallen patients, and only requiring one carer or responder to safely lift them in just a matter of minutes. So our guest speaker today will be talking a bit about that. So as well, and then I've got some exciting news in terms of promotional offers about that as well later on. But for now, today, I would like to introduce our guest speaker, who is Matt Heudebourck-Emmerson, and he comes from the UCLH, so University College London Hospital, the NHS Trust. And I will let Matt give a bit of an introduction himself to some of his background and his experience, which I'm sure he will do. But he's one of our opening panel members of the Healthcare Pioneers Board, which we've recently launched. So I can send us some more information about this to everyone afterwards, but it's a board of healthcare experts and people with experience who we've become acquainted with over the years, the 50 years that we've been in the industry. And we put together this board to really build on our mission of enhancing lives through advanced care by working together to educate, influence, and innovate within the healthcare industry. As you can see, our mission is there. So I won't take any more time on that, though. I will hand it across to you, Matt. Welcome today to this session, and I'll let you take the floor.
Thank you very much. What I'll do, I'll just start sharing my screen. Okay, I'll just give you a prompt for next screen. Good afternoon, everyone, and thank you very much for attending today. Really exciting, and I think it's really important, this session we're going to cover today, especially with the ongoing problems within our staffing groups, and obviously winter pressures and so on. So here at University College London Hospitals, I'm the trust lead for manual handling over here. Recently joined, I was previously working up at University Hospital Southampton, where I was the trust lead there. So I've been using this product for a few years now, and again, I've been involved in some of the advice and guidance around how we implement it, how we use it, and looked at all different types of applications where it can actually be fitted into as well. And to be fair, can I just say this is a fantastic piece of equipment. It really will help with reducing musculoskeletal disorders for staff, but also giving our patients and the people under our care a better experience of being mobilized. So if we can move on to the next slide, please. So here we have a fall. So it's described as inadvertently coming to rest on the ground. Well, obviously we're coming into the seasonal period. Please just be careful with that inadvertently coming to the ground, especially after all the Christmas snowballs and the drinking this year. So just be mindful of that. But obviously coming to a lower level without a loss of consciousness or the consequences of sudden onset of paralysis, epileptic seizure or excess alcohol intake or overwhelming external force. So that's the definition of a fall. Next screen, please. Okay, so about falls. So most falls do not result in serious injury. So again, people do tend to bounce well, but going forward, where people could be quite young or quite old, and there's that gap in that age range, obviously people are more susceptible to injury. But also, again, where people have also had that fall, they do start to lose confidence. They then start to become withdrawn because they don't want to actually participate in the activity of getting up because, again, they've lost that trust. They've not enjoyed that experience of falling on the floor. And again, it then becomes that fear factor. So it's important for us not only to use the equipment, but to use our powers of persuasion to assist our patient or the person we're caring for to be able to get them feel, happier about using the equipment. So we've got a definition here, the long lie. And this is a term that we use for when a person has fallen and they've been on the floor for more than an hour whilst they're waiting for assistance. So an important note to remember around these waiting times, historically in the background, people have always thought, oh, someone's had a fall, let's call the ambulance, especially where we're not in an acute setting. We could be, mental health, we could be in a care home, or equally, in a shopping centre. So again, people think, oh, we'll call an ambulance and they'll come running, blue lights and sirens, when in fact, actually, the ambulance service is also having, a drain on its resources, as well as facing winter pressures as well. So with that in mind, you know, we need to be able to support our patients and be able to get them up off the floor. Because remember, you know, when the ambulance service are grading the calls, they will grade them on a time factor. So, you know, we've all seen the latest, you know, newspaper reports and things like that, where, you know, people are saying, oh, my mum waited, you know, 10 hours for an ambulance. There is a possibility that they may wait 10 hours for an ambulance because, again, the ambulance calls are graded differently. So what we have to do, think about our own establishments, carry out our risk assessments to ensure we've got the right equipment to be able to support our patients. So with regards to that, you know, thinking about the long lie, it can also exacerbate other health conditions. You know, if someone's got a respiratory disorder and so on. So then that way, it could then lead to a longer stay inside an NHS environment or in a care home. Next slide, please. So we've got a lovely picture here that shows that, you know, within the NHS, we've got over 250,000 falls every year. I mean, that is just a staggering amount of people that fall each year. Really, really staggering. And again, you know, some of these 20% are long lies, that they've been on the floor for at least an hour or more. 2.8%. People are developing pressure ulcers while sat on the floor as well, or lying on the floor. So again, although, you know, it's a case of waiting for the equipment to get there, well, we need to make sure we've got enough equipment to be able to, you know, get this person off the floor so they're not developing the pressure sores. And then with that in mind, we're actually then leading to 12.3 days extra in hospital for each faller. So that's also going to have a massive cost impact on, you know, the cost of a hospital bed. An overnight stay in hospital is around about £700 mark. So thinking about that, the actual resources that it takes to manage a fall within the NHS, massive amount of money. 50% of fallers are aged 65 and over, but again, unfortunately, go on to die within the next 6 months because a lot of the falls do come with contraindications, which also lead to other health implications as well. Next slide, please. So the impact of a long lie. So delayed initial recovery, obviously longer than 10 minutes, but less than an hour. And the long lie is obviously over an hour. So thinking about that, we're going to think about things, someone's over an hour, pressure sores, incontinence. So incontinence is going to lead to pressure sores, breakdown of tissue. The patient may be dehydrated, hypothermia. So again, if they had a fall outside, and again, we're waiting for that recovery, we've got that issue of where the patient, again, with the winter pressures, and the colder weather now coming in, especially here in London, we've got a really bad cold snap going at the moment. You've got hypothermic patients waiting to be recovered, you know, on a cold ground, not great. Psychological impact, well, we kind of looked at that a little while ago, where the person sometimes doesn't want to engage to be able to get up out of a chair because of that fear factor and that psychological impact of having another fall. The increased likelihood of hospitalizations, especially where people have that comorbidity or the injury that has really caused that injury to be exacerbated. The increased likelihood of actually the patient falling again. Death, well, 20% of those over 65, unfortunately, obviously do go on to require other health-related issues, which ultimately do result in the patient obviously passing away. Next slide, please. So why do people fall? So let's think about this. So let's think about the person. So it could be that they've had previous falls, impaired balance, the medical history. So they could have had a post-CVA, they could have cardiac problems, fear of falling, medication. issues. So polypharmacy is also an issue where a patient's taking on too much of a different medication and they're all working against each other. And acute illness, even down to something like a UTI, dizziness, postural hypertension, reduced muscle strength, foot problems. So again, where a person may have an abnormal gait, it could be down to ingrown toenails, could be down to fallen arches and so on. Continence issues, your cognitive impairment as well, where again the patient couldn't see where they're going, or it could be that they've got glaucoma or hearing impairments. And again, ultimately, anything, it could be related to pain, which is one of our, baseline recordings that we would take to find out, from 1 to 10, are you in any pain? Can you let me know from that range? Environment, so steps, stairs, and again, in the winter months, we need to make sure that, where the person's had the fall, we record if the stairs have been gritted or not, because again, it could then reduce the fact that other people are falling over. Floor coverings, well, during COVID, the biggest rate of falls that we had is people falling over the do not fall over the wet floor signs. So again, when you're wearing your masks for COVID and you had your glasses on, you just couldn't see them. So be mindful of that. Poor lighting, lack of appropriate adaptations, low furniture, no access to telephone or alarm systems. So again, in a lot of areas, they do have things like telecare. So the person affected can wear a little lanyard around their neck. They can press a button. So if they've had a fall, there'll be a telecare responder who's able then to find out what's wrong and then send appropriate resources. Temperature changes. So again, that could be another reason why a person's falling, a loss of body heat and so on. Thresholds, animals, diving in and out of their feet. Yeah, it's nice to have a little puppy to sit on your lap, but if it gets a little bit excitable, that could be the reason why you're falling over. So other things, so limited physical activity or exercise, where a person starts to, lose their core stability. The person will start to not be able to lift their legs up, actually get out of the chair. So that's really an issue to, again, why people are falling. Poor nutrition. People sometimes, again, even me, when I'm working, I forget to have a drink sometimes. So, I'm young, fit and healthy, well, youngish. So again, making sure that our patients have got that fluid intake. Alcohol intake, well, we know it's the seasonal period coming up where we all have a little break. So be mindful of your alcohol intake, because again, that could be a reason why we're falling. And then obviously, high risk behavior, climbing on stairs, ladders, that overreaching rather than moving the ladder, that could be a reason for falling as well. And again, a thing that we have within our acute trusts is lack of footwear. Sometimes if we haven't got the toe socks on, our patient can actually fall, which is obviously, not great for them. So again, make sure your risk assessments are done and the patients are wearing their footwear. Okay, next slide, please. So some stats. So looking at the ages of people 65 and over, okay, over 40% of those within the next 17 years, obviously goes to 16 million. Wow. We really need to kind of think of these stats to look at what we can do to reduce these falls. 30% of people aged 65 will fall at least once a year. These figures, oh my word. This is, something that we really need to act on now, so we can actually look at what we can do to reduce that level of impact. So a fall can lead to pain, distress, loss of confidence, loss of independence, and around 5% of cases will lead to fractures and hospitalization. Now, I know within my role, when I talk to patients that have had falls, again, it's that fear factor. You know, they don't want to engage with you again. That does lead to them becoming deconditioned because they're so scared now to start to, you know, get from the chair without equipment because of that injury, that pain, that long lie they've had. And again, that psychological trauma is always there. So falls are a high volume and costly, with around 255,000 falls related to emergency hospital admissions for older people in England. Now, I was previously with the ambulance service many years ago, and I remember a lot of our work was going out to people who have fallen. Again, you know, not sort of too high, maybe rolled out of bed, or they've got out of bed to go to the toilet, or they've slipped off the toilet. And again, a lot of those needed to be recovered. Not many of them had injuries, but again, it was a massive drain on resources for the ambulance service because we weren't then able to go out after cardiac arrest calls because it could take 2-3 crews to actually deal with this fall. Next slide, please. Still on the falls stats, falls within hospitals. That's the most common safety-related incident, with more than 240,000 reported in acute and mental health trusts. But again, from that, we do have to remember that a fall is designated as, you know, putting yourself to the floor as well. And I know from my experience of working in acute and mental health trusts, we do have a number of patients who actually purposely put themselves onto the floor when it is recorded as a fall, but there's a no harm or there's no injury fall. So falls are the most common cause of injury-related death in people at the age of over 75. Wow, that's scary, that is, with 5,000 older people dying as a result of a fall. And again, working in healthcare over my career, 20 odd years, I have had to deal with patients, you know, they've had a fractured neck of femur, which has led to a pulmonary embolism or something else. And, you know, unfortunately, a week later, they've sort of passed away, which is really very sad. So, you know, within my role, I'm really sort of keen to try and look at how we can reduce the risk of falls and obviously increase our knowledge about how we can actually reduce the falls, but equally also help our patients who have had the fall. First line defense in falls is obviously to prevent these long lies. Next slide, please. So the winter pressures, every year we get the winter pressures. So it's getting ready for these winter pressures. So make sure your rotas are all done. Winter pressures do really add a strain on the healthcare services. Again, working in a hospital for all these years and in the ambulance service, I've gone through lots of winter pressures. And again, you know, it has a lot of pressures on the staff, on the resources, as well as, you know, the way we increase on the admissions where people have fallen over and broken wrists and so on. Longer waiting times. So again, if we can actually do something before the patient gets to hospital by recovering the patients using the Raizer chair, then I think that way we're doing our little bit to try and prolonging and reducing the risks and the pressures to the NHS establishments. Next slide, please. So 2022, the winter of discontent. Oh, I remember the snow. Obviously, the ambulance strike did have a significant effect. Being an ex-army medic, I saw a lot of my colleagues from the military, but also being a part-time firefighter, again, a lot of my colleagues from the fire service were actually going out and manning ambulances as well. And part of my role in the fire service as a training officer was actually to train fire service co-responders to be able to then assist our ambulance colleagues to be able to then recover patients who'd had a fall. So part of my role in the fire service was to train up telecare responders. So once the local authority received that notification, that someone had a fall, the fire crew then activated, and then they were able to go out, carry out a medical assessment, and safely lift the patient up. Obviously, within this year already, we're now starting to feel the crunch from where we've had this cold spike coming in early. Again, I know from my trust, we're starting to feel the winter pressures as well. And again, with the recent train strikes and so on, that's also causing an impact around the sort of care environments as well. So again, what we can do to reduce these risks and pressures onto the acute and community care trusts and our colleagues in the ambulance service is to look at falls, make sure we do our risk assessments, make sure we've got the right equipment, and make sure we've got the equipment we can recover our patient off the floor, and obviously make sure that we do it in a safe manner. Next slide, please. So thinking about what we can do to help prevent the long lies and the winter pressures. Next slide, please. So do not have a no lifting policy. Can you imagine that? I knew one trust once who said they had a no lifting policy, but you imagine that. You couldn't lift your coffee cup, you couldn't write any reports, because if you had a no lifting policy, you wouldn't be able to do it. So again, thinking about the RCN guidance is a reduced lifting policy. So we reduce our lifting by ensuring we carry out our risk assessments. So again, making sure we've got equipment, we carry out our risk assessments, but equally, we are going to try and avoid the falls in the first place. But equally, we also want to consider the reduction of deconditioning our patients and trying to encourage them to do as much for themselves as safely possible. Next slide, please. So ensure you've got your risk assessments in place. An absolutely fabulous tool, and I love an acronym, I really do. And this is available as an app as well. If you go on to Google Play or whatever system you're using, you can download this. And this is absolutely fantastic. I stumble. So starting with the I is intense pain. So you're going to measure from 1 to 10. 1, it's a paper cut. 10, you're on fire. The S, suspected collapse. Well, what's the mechanism of injury? How did they come to be on the floor? Trauma. Is it where the patient's had an unwitnessed fall and you suspect there could be a neck, spinal, or head injury? So do you need further resources to immobilize? Unusual behavior. So when they've actually gone to the floor, is it down to a mental health condition? Could they have a UTI? Or could it be actually they've had a fall and that's now caused them to have a head injury where they've now got combative behavior? Again, think about the breathing. So if they are finding it difficult to breathe, we need to be aware of that as well. So early response to any breathing difficulties. And again, going back to our acronyms, look at your ABCs. Make sure that we're going through airway, breathing, and circulation, which we come on to the B. Bleeding freely. So if our patient is bleeding freely, we need to obviously control that bleed and deal with it appropriately. That obviously leads to loss of consciousness. But again, if the patient has lost consciousness, well, that could be a query where they've had a head injury. So again, we would need to fully immobilize and ensure we carry out neuro-obs as well to check for any further damage. And then we're also going to be looking for evidence of fractures, so shortening, rotation, the feet are actually splayed out, so that could suggest a fractured necrosema or a fractured pelvis. So with all that in mind, we could then obviously consider what resources we need or what further stages we need to go to obtain more advanced help. Next slide, please. So think about your investments. All of this information will help you with your business cases. You think about how much it costs to send 8 members of staff with a scoop stretcher, to go and deal with one person that's fallen. And also remember, a scoop stretcher where our patients are getting bigger, a scoop stretcher, the safe working load is only 150 kilos, whereas the Raizer chair can lift more than that. So it's a safer option, less staff, more cost effective. Next slide, please. Next slide, please. Thank you. So introducing the Raizer 2. So if you've ever seen the Raizer 1, so if you've been to any of the National Back Exchange conferences, or you've seen some of the demos previously, the Raizer 1, lovely bit of kit. It was very easy to use, had a little spindle on the side so you could just wind it up. It was absolutely bulletproof, nothing really could go wrong with it, minimal maintenance. But to be honest, at the end of the day, everything comes to the end of its life. There's new innovation out there, and this is where the Raizer 2 was born. So when the Raizer 2 was born, lots of conversations were had with, first responders, hospital staff, mental health staff, to look at how we can utilize this equipment. So it's really, really easy. It's a remote control operation. So again, you can encourage your patient to actually use the controller to get themselves up. So it's powerful. This patient's up to 150 kilos in weight. Now, I know going forward, they are planning to look at a plus size version. So watch this space. It could be in development. Lightweight and portable. So I've actually carried one of these units through London on the tube. Again, it's a lightweight, versatile piece of equipment, and it fits easily into a car, a vehicle, but equally, it's not too heavy to carry, and it's not going to be a contributory factor to musculoskeletal disorders within staff. Easy to assemble, it's very fast. We set it up in literally a couple of minutes. We had the patient up off the floor, again, in a seated position, in a far more comfortable position. It's got inbuilt safety features. So if it's not correctly assembled, it will not work and it will not activate until the right bits are in the right areas. So again, if you put the wrong leg in the wrong hole, it doesn't matter, because all of the actual, the 4 feet can be are versatile and they'll fit in any of the holes, which is great, because then again, in a full sort of situation, you've got a high sense of anxiety, you're trying to get that patient off the floor. So people do make mistakes. So this piece of equipment is so easy to use, it actually reduces that as well. It's nice and easy to clean, just wipe it over with Clean wipes, or again, any bloodborne material, or it could be any feces, any urine, anything like that. Actichlor Plus, let it dry, then Clinell wipe it over. Next slide, please.
So we do have a bit of a video, Matt, which basically just shows the Raizer in action. So are you okay if I play that now?
Fantastic.
You hearing that?
My name is Michael, and my job is to instruct my colleagues in lifting and moving fallen persons. Whenever you carry the Raizer backpack, always ensure that you adjust the ergonomic back straps. The ergonomic handle of the seat allows you to carry it close against your body, which is the optimal position for preventing back and shoulder injury. I now want to show you how to assemble the Raizer lifting chair under a fallen person in a way that is optimal for both you and the person on the floor. When you attend a fallen person, the first thing to do is to check their state of health. The aim here is to ensure that the person has not been injured by the fall and that they only need your help to get them on their feet again. With advantages, you can find a couple of cushions. Place one of them under your bended knees. Turn the fallen person onto their back. This will enable you to assemble the Raizer chair underneath them. Place the other cushion to make it more comfortable for the fallen person. Avoid lifting from below knee height by pushing the seat component under the person's bended knees. Bend the person's knees as tightly as possible. Help them by telling them to hold their lower legs in against the seat. Now you can unpack the chair components, the 2 identical backrests and the 4 identical legs, and place them in the order in which you want to use them, one side at a time. This will prevent overstretching and putting strain on your muscles and joints. As soon as the bag is unpacked, you can focus on assembling the chair and looking to the person's well-being. Next, ask the person to cross their arms and turn their head away from you. And with a little push on the elbow, you can create even more space. Enough to allow you to slide the backrest under the person and click it into the seat. The sounds that the chair makes confirms that all the parts have clicked correctly into place. Always place your foot against the seat while clicking in the backrests. This prevents the seat from being pushed down. If the seat should move downwards, the person on the floor may easily end up hanging from the backrest instead of sitting on the seat, and will slide or fall down onto the seat when the chair is lifted. Place the safety belt across the person's stomach so that it doesn't get in the way when you are clicking in the legs. Avoid reaching across the person to find the other side of the safety belt. Bending your back too far forward is at least as aggravating as twisting or asymmetric loads on the back and arms. During this process, you should be talking to the person and telling them what is going to happen. Now, tighten the safety belt, which not only secures the person on the floor, but also guarantees your safety when you are doing the lift on your own. The green light and sound indicate that Raizer is assembled correctly and now ready to use. Remove the remote control from the seat or use the control panel located on the opposite side of the seat from the remote control. Now tell the person on the floor what is about to happen. Place your hand under the person's neck to support their head as the lift begins. If you need to make the person more stable during the lift and also to allow you more freedom of movement, you can use the headrest. The headrest falls easily into place between the 2 backrests. While the lift is in progress, be in a stable position while supporting the person's head. If necessary, you can hold or support your elbow using your other knee. A good tip here is to use the Raizer chair to help you keep your balance as you raise yourself from a kneeling to a standing position. Use your thigh muscles and lower back to avoid injurious stretching. Stand in front of the person as the lift comes to an end, with your hand on the person's shoulder to provide comfort. This gives you an optimal view of the person, the chair, and the lifting process. When the chair is raised to its full height, the person will almost be in a standing position. This makes the rest of the lifting and moving process easy to complete. A comfortable lift for both the helper and the fallen person. It is very important after a lift to lower the Raizer chair and pack it away correctly. Lower the Raizer chair until it stops automatically, which will be indicated by a beeping sound that tells you that it is now in its starting position. This ensures that the turning joints on the side of the seat are in the correct position the next time you need to assemble the chair. All Raizer components have their correct place in the carrier bag, making it easy for you to find them. Using Raizer enables you to minimize the strain on your body throughout the lifting process.
There you go, Matt.
Thanks very much, guys. So a little bit of a wobbly video, but obviously we've got so many people online, it can't beam out to everyone. So if you do have problems, let us know, and the team are going to send out the video anyway. And again, over the years, I've developed some resources as well. So if anyone wants any risk assessments and things like that, I'd be more than happy to share them out as well. So coming on to the user benefits. So within the NHS, we've been challenged this year by the Health and Safety Executive, and they've sent a letter to all the chief execs to say, right, NHS, you need to start looking after your staff. So what are you doing about reduction of upper work-related limb disorders and MSDs within your workforce? So with that in mind, using this piece of equipment to assist our patients up off the floor are definitely going to reduce that level of risk to our staff. So again, when we think about it, only one member of staff needed, but that is equally dependent on the risk assessment. Reduced waiting times. So again, once we've got that person up off the floor, again, we're not going to obviously have further health complications, and then that would then obviously bring longer stays into hospital. Reduced time for the care staff. So again, it takes just a few minutes to actually get the patient up off the floor, rather than having a whole team go out to actually start to lift the patient up off the floor. I think we've got someone in the background who's not on mute. Can we just check we're all on mute? So significant savings in human resources, because again, our workforce is going to have less time away with injury. And again, dignity for the fallen person. So I've used this on a number of different patients and again on colleagues, and they actually feel a lot safer being lifted in this device as well. And the financial savings, well, to be honest, when you start to prepare your business cases to your procurement teams, well, to be fair, when you're putting this and you actually look at the cost of a nurse being off sick, you know, 45,000, and then you've got to cover the nurse time off, which is say another 45,000, have an agency staff and so on, where the benefit of this is actually going to, you know, reduce the amount of time staff are away and keeping your workforce safe. Next slide, please. So thinking about other areas it can be used. So we've got a whole list of these. So some we haven't mentioned, but I've just had a thought and we'll talk about them after. So the emergency services. So again, I said that, you know, I'm ex-ambulance service and I'm also part-time in the fire service as a training officer. This piece of equipment is absolutely fantastic. It can be charged in a vehicle. It's easy to carry. It's easy to operate. It's quite lightweight as well. And again, you know, where we have rapid response teams going out within the community, you know, ambulance paramedics, again, it fits into a vehicle nicely. It's on charge and it can be used in multiple areas. So it can be used on all services. It's easy to store in the vehicle as well, only takes up a small footprint. We've actually had this on some of the fire engines and it's actually sat in the crew space nice and easy as well. Easy to use, fast assembly. It helps with the emergency response team because, again, you imagine if you've got a single responder in a response car, you don't need a full ambulance crew to come out. You can just use the one person. Easy to clean, and again, it's a safer option, and we're actually following through with the health and safety executive requirement by making sure we're keeping our workforce safe, which is a big, big, big important factor for me. Next slide, please. So in hospitals, so using it in a hospital arena does reduce the risk of a long line, therefore would reduce the amount of admissions we have and the overstayers. And again, the extra bed days that patients have as a result of a fall and other complications as well. So again, you know, making sure we've got that right equipment in the right place, equally will then result in, you know, patients are not bed blocking. We're able to get our patients, you know, up out nice and well and actually discharged in a timely manner. So again, thinking about some of the other benefits that we've already discussed, human resources, so it's not so much of a drain on the workforce, reduces bed stays, reduces long lies. And again, you know, the other big one for me, easy to clean, reduces the risk of infection because you're just going to wipe it over with Clinell wipes between patient uses. Next slide, please. Other areas, nursing homes. So again, where the nursing homes rely on, you know, the calls to the ambulance service, and again, remember, you know, we've all seen the press where, you know, they've waited 20 odd hours for an ambulance. Yes, unfortunately, that's the state of play at the moment. So, as a health resource, a nursing home or a care home, we do need to consider that we need to have the appropriate equipment to be able to support our patients. So again, thinking about in care homes where it's only one person on a night shift, one person to use the equipment. Okay. So again, I'm not going to go through all the key benefits because they're the same for the majority of areas. Next slide, please. In the home care. So again, I've taken this out to show a friend of mine, and a friend of mine who was owning a stable. And she said, her mum is getting quite frail these days. And she said, I'm really worried about her. We're out in the middle of nowhere. We're at the stables. What happens if she has a fall? I can't lift her up on her own. So we got a chair out to her and we tried it. We put a couple of scenarios in and it worked absolutely fine. But it also gave her the confidence to actually go back out and see the horses. So it actually improves her mum's well-being as well. So really, really important for me because now she's not deconditioned. She's got that reduction of fear factor and she's happy to engage more because she knows there's a resource there. If she falls, she's going to be safe and well. Next slide, please. So just before we move on to the questions and answers, there's two other areas that I'd just like to touch on for use as well. So therapies, really good for therapists to have, when you're doing your stair training, your rehab, rather than walking around with, extra pieces of equipment, wheelchairs and so on, use the Raizer chair. You can have that in situ. Again, you can recover your patient in a timely manner. And again, it takes up such a small area for you to be transporting it as well. So again, if you're doing a community visit, you're in an occupational health or therapy setting where you're getting a patient trained to use their kitchen again, and they stumble, you've got a way to recover them. And then the last one is within a mental health setting. So within a mental health setting, I've trained mental health, registered mental health nurses, and also our own security team in accident and emergency to use the chair to actually lower someone to the floor rather than lift them up. So we had a combative patient and he had to be chemically sedated. So when he was chemically sedated, the security staff were able to passively restrain him, lower him down into the chair. So we then were able to then lower him down onto the floor. We could then put him onto a floor mattress in a seclusion room where he was able to rest and recover from his issues. So again, thinking about, not only being able to lift a patient off the floor, there are certain times you're working with disabled children and so on, getting them in and out of a wheelchair, maybe out of a wheelchair to get them onto the floor for a bit of play therapy. Again, you can use this equipment for that. So that's all from me. I'm sure you're all going to be sick and tired of listening to my voice. So let's go for some questions and answers and see if anyone's got any questions for us.
Thank you, Matt. That was a very, very informative presentation. And yep, again, I'll just like to invite anyone so you can either pop any questions you've got on the chat of the Zoom call, or otherwise be free to unmute and say it out loud if you prefer that. We've just got one comment from Jane Walker, Matt, who commented on the fact that at her trust, the policy is if someone has a fall and injury, they're unable to pick people up without them being assessed by paramedic or other such professional. What would your comments be to that?
So again, it depends on what sort of healthcare setting you're in. I mean, if you do have registered healthcare professionals, a paramedic is not going to do anything different than a registered healthcare professional. So if you're working in an area where you do feel you have patients who are at high risk of falls, then, make sure when you do your moving and handling training that falls training and falls assessments is covered in that training. Because to be honest, trying to wait for a paramedic crew, you could be waiting an awful long time. Whereas, again, an assessment using the I-Stumble, and obviously it is part of your stat and man training under manual handling to be able to assess someone to see if it's safe to assist them.
Thank you. And then we've also got Rachel asking, in your experience, have care homes using I-Stumble app cut down on ambulance call-outs for non-serious falls?
To be fair, I know from speaking to colleagues and another company, the I-Stumble was used quite extensively in the East of England Ambulance Service, and it was actually used in Wales as well, where they had a significant drop in ambulance attendance because, again, they went through the I-Stumble acronym, they went through to 999 and were able to get clinical advice from a paramedic on the phone to carry out that assessment in a safely and timely manner.
Brilliant. That's good. That's brilliant. Thank you. And then we've got a comment from Margaret asking what the cost for this equipment is, but I'm going to be presenting a little bit on that, Margaret, just because we've got a bit of an offer at the moment on them. So I'll just keep that to the end. So we'll come back to that one. But I'll just like to invite anyone else who might have questions to, in regards to falls, to bring them on the chat now. So we've covered a lot today. I'm aware of that from a lot of information about falls and the impacts they can have on patients and healthcare organisations, right through to risk assessments and investing in Raizer Patient Lifting Chairs and removing no-lift policies. But I'm sure that there's a lot of value to be got from Matt's wealth of experience and knowledge.
If anyone has, if anyone has got any questions they think of afterwards, you can always contact me through VidCare, and the guys will pass it on to me, or through the chat box on the National Back Exchange forums. So I'm on there quite a lot. I actually sit in the Oxford group, but again, I do go on there quite a lot. I'm quite vocal. So again, after the session, if you think of something, you can kind of drop me a line on either of these platforms, and I'll be more than happy to, I'm happy to share resources. Let's not reinvent the wheel. And I'm also happy to give you advice and guidance on some of the risk assessments and some of the activities that I've been involved in the past.
Brilliant. Thank you, Matt. And then we've also got Leslie asking, how easy are the Raizers to use in a confined space?
So again, like anything, Leslie, in a confined space, it's dependent on how much space you actually have to use. So I would say inflatable products in a confined space are always going to be better to use because you can let air out to be able to make them more mobile, whereas the Raizer chair is a solid structure. So you need to do your risk assessment first, do your Tilio assessment, and see if it's able to fit in that space first. But again, when we think about a confined space, it could just be the width of a patient. So if we're working within a width of a patient, then I would say, here's an example that I use in my training. Patient has wandered into a staff toilet on an acute ward by mistake. Someone's left the door open. Staff toilets are quite small. They've obviously slipped off the toilet, had a fall, non-injury. So yes, you could use the Raizer chair to lift them up off the floor because there's enough room to do it. So with that in mind, it's all about your risk assessment, whether it's safe to use that equipment in that area. Brilliant.
Thank you. That's really good. And again, yeah, if anyone does have any more questions, be free to fire them through to us after the webinar, and we can get answers from Matt as well. We do have a lot of other free resources on our website. a huge amount. A massive part of what we want to do for carers and patients alike in the healthcare area is to provide resources to share best practice and to just be able to educate better. So we've got ebooks about specialist seating. We've got downloadable justification forms and templates if you're trying to get funding for equipment. We've got prescription forms for seating assessments, training videos, previous webinars, and a whole host of blog articles and insight articles on the website. This year, we've had a lot of webinars about different topics which have come up from the people we're talking to, from the clients and the patients and the carers that we're in touch with. But going into next year, we are going to be running a lot more CPD style events, so real training in various different areas of seating and moving and handling. So keep an eye out early next year for the announcement of these events. We'll be very glad to have you on board for these. And with that, thank you very, very much for joining this afternoon. I hope it's been helpful, and thank you again, Matt, very much for your time and sharing your knowledge and experience. It's been much appreciated by everyone. Thank you very much, everyone.
Absolute pleasure. Take care, everyone, and have a good Christmas.
Great. You too. Thank you.